Partial. Okay. And all are in favor of partial? I'm talking about all of us who are supposed to be healthy, normal individuals. Okay. If we check our urine, does it contain traces of glucose, a little amount of glucose, or it should not contain glucose at all? It should be nil or zero. What do you think? Okay. One sample of the urine, it should show glucose or no? It should show? All right. Okay. See, glucose is such an important nutrient of the body that the body cannot afford to waste it. Body allows it to be filtered, no problem. Okay. But body makes it sure, the nephrons make it sure that all the glucose, 99.99999%, even 100%, we practically speaking, we reabsorb that glucose in normal persons. If they don't have any disease, there is no problem. All the glucose is reabsorbed by all means. It's coming back. If it's coming back into the body, then there is no problem. Okay. So filtration, reabsorption, coming back. Khalas. If it is coming back, practically speaking, 100%, then what is your idea? In urine, yes or no? No. So now we are coming to one statement. Urine does not contain glucose even in traces under normal conditions. Okay? All right. One process is filtration, one process is reabsorption. Okay? And there is one more process in the nephrons which is going on. Anybody remembers that process? Okay. See, if you are bringing something from the blood into the nephron, this process is filtration. If you are taking this substance back into the blood, this is reabsorption. But if you are bringing some substance from the blood into the nephron, from the cells, or if the cells of the nephron are producing some substance and that is coming into the lumen of the nephron and going into the, then you call it secretion. So it means now we have decided about three processes. Number one, filtration. Number two, reabsorption. And number three, secretion. If you are doing all these things, at the end of the nephron, after doing all these processes, some fluid is finally formed. What is that process fluid known as? It's urine. Okay. So urine is the sum of all the processes: filtration, reabsorption, secretion, and then finally it is decided about what kind of urine is formed. Okay. So we'll talk about all these processes, but the very first process for the nephron is definitely to bring something. Okay. So we'll talk about that. Okay. We'll talk about the dynamics of filtration, but we still have few things very quickly now. Things are very easy and conceptual, really. Okay, you just have to think, answer, listen. Okay, try to interact. It's very, very easy. Okay, you will logically find answers of all your questions just by discussion. Okay, very little memorization is required in this process. Look at the objectives first of all. It's about the glomerular filtration. Okay, we'll talk about different factors or different forces which are causing the glomerular filtration, which are controlling the glomerular filtration. You will see that. Okay, so this is the idea of the lecture, today's lecture. Very quickly, we have to develop a concept of glomerular filtration. What do you mean by glomerular filtration? We'll talk about few definitions and terms which are staying around glomerular filtration to help you understand what is going on and what forces are acting in the region of the nephron where filtration is occurring, and what forces are controlling the filtration. Okay. Right. Do you find any special thing, any new term in this slide? Have a look at the slide. I hope you can see the slide. Okay. Yeah. Histology is done, right? So you are familiar with the parts of nephron. The idea is not to discuss the parts of the nephron, just to recapture the terms in the mind for discussion. One term is renal corpuscle and one term is renal tubule. You are dividing nephron into two parts. Are you comfortable with this one? Renal corpuscle is the upper part, beginning part of the nephron. What does it contain? Bowman's capsule and the glomerulus. Two things are there. Our focus is these two things right now. We are not talking about the tubules in detail because tubules will come later. We are talking about filtration, so we are focusing the very first part of the nephron, and that part is renal corpuscle. Okay? All right. But we need to get oriented about the nephron very quickly. This is a nephron. You can see the upper rounded part. You have seen it in histology also. Okay. Two terms. Are you catching the terms which are written here? Cortical, juxtamedullary. Okay, two terms. Used for nephrons, yes or no? All right? All right. Okay, cortical, juxtamedullary. Why are you calling and using the term cortical and why juxtamedullary? Reason. Just reason. Think why. Position of what? Yes, Abdullah?
Cortical, its position in the cortex.
Okay. Look at the picture. The upper part of the kidney, lighter part is cortex, and the lower part is the medulla, right? Okay. Now Abdullah is saying cortical nephron is present in the cortex and juxtamedullary nephron is present in the medulla. Are you saying that, Abdullah? Does this picture tell you the same story what Abdullah is discussing? Cortical nephron is present in the cortex. Okay. Is it completely present in the cortex?
No.
Part of it. So it's partly present in the medulla also. Now look at the juxtamedullary nephron. Is it completely present in the medulla? No, it's not completely present in the medulla. Then it cannot satisfy the definition. It means position is right, but position of what? Now look again. Position of what? Tubules. Well, tubules are actually the problem. Tubules, some part of tubule is present in the cortex and some part is present in the medulla. So you can't call anything on the basis of tubules. Go for something else. Look at the picture. Corpuscle, basically. Look at the corpuscle in which the glomerulus is present. Now look at the cortical nephrons, please. Look at the cortical nephrons. Where is the glomerulus of the cortical nephrons present? Please have a look. In the cortex, definitely. Okay? In the lower part of the cortex or in the middle part of the cortex or where? In the look at the cortex. Okay? Is it present exactly at the junction or it's present a little up in the cortex, in the middle part or something? Middle or upper part, different positions. But definitely it is present in the cortex. Okay? Look at the glomerulus of the juxtamedullary nephron very closely. All of you, look. Find out yourself. What is the position of the juxtamedullary nephron's glomerulus?
Near the junction?
Okay, near the junction, but still your answer is diplomatic. Near the junction means on this side or on that side? Near the junction means you are talking about the cortex or you are talking about the medulla. Choose one side. Junction is the dividing point, okay, where two are meeting, cortex and medulla. So the glomerulus of the juxtamedullary nephron, look at the picture. Is it present in the cortical side or in the medullary side? Still it is present in the cortical side. The glomerulus and the Bowman's capsule, it is not present in the medullary side. Okay? Do you see that? What is the meaning of the word juxta? Yeah, very near or touching. Juxta means in touching position or very, very close. I am in juxtaposition with him. I am touching him now. Okay? So it's juxtaposition, isn't it? Okay? Just touching almost. So look at the name now, juxtamedullary nephron. You are saying juxtamedullary. What is the meaning? Okay, just touching the medulla. Is it so? Mawjood in cortex, but touching the medulla. Okay? Now it gives you a sense, an idea about that. All right? So what do you say? If I say both the glomeruli of all the nephrons are present in the cortex, am I right or wrong? I am right, okay? But the glomeruli of some of the nephrons are present very, very close, almost touching to the medulla, still in the cortex, but touching the medulla. True or false? True, okay? And the glomeruli of the most of the nephrons, they are present in the upper positions, middle part, upper part, anywhere. For sure. Right or wrong? So, now you know the meaning of the cortical nephron and the juxtamedullary nephron. Okay? So don't call anything on the basis of tubule. Don't call on the basis of the whole position. You have to focus a reference point. Your reference point is glomerulus. And look at the position of the glomerulus. That's why you have named cortical and juxtamedullary. Am I clear about that? Okay. All right. Okay. Now, look at this picture. Do you see the two different levels of the nephrons which are shown here? The two nephrons are shown here. Can you identify the nephron, the upper one and a little lower one? The upper one is cortical. The lower one is juxtamedullary. What differences do you see in these nephrons apart from their general position which is there? Okay. Is there any other difference in juxtamedullary and the cortical? Yeah. Shape. Okay. All right. What difference do you find in the shape? First of all, go to this picture. Generally speaking, what difference do you see? Okay. There are some differences in the loop of Henle. Good. That's one point. And size you are saying. Which one is short and which one is long? Juxtamedullary are long. They have got long loops which are going down, isn't it? And cortical are short structures, short loop nephrons. Okay? Cortical are more in number or juxtamedullary are more in number? What do you think? Cortical are much more in number. Okay? 65%, 75%, up to 80% or even more are cortical nephrons. And 15, 20, 25, 35% are juxta. Okay? All right. So short loop and long loop nephrons. Great. Okay. Now, look at the blood vessels. Now in this picture, blood vessels are shown, right? Okay. Some blood vessels are associated and they are covering the cortical nephrons. Can you see? Just look at the nephrons and see some vessels are covering, enclosing the cortical nephrons, and some are associated with the juxtamedullary nephrons. Okay, these are the capillaries you can see. Okay, so some capillaries are related with the cortical and some capillaries are related with the juxtamedullary. Can you find out the name of the capillaries which are associated with the juxtamedullary nephrons written here? Vasa recta. Anybody has heard this name vasa recta before?
Yes, vasa rosa. In the heart.
Okay. In the heart?
No, in the aorta.
In the aorta?
Yes.
Okay. Vasa recta. Straight type of vessels. Straight. Long and straight vessels. Okay. These are capillaries. Okay. So now please remember the capillaries which are associated with the juxtamedullary nephrons, these are vasa recta. Look at the capillaries which are associated with the cortical nephrons. Any name written or no? No name is written. These capillaries are present around the tubules of the cortical nephrons. Around the tubules. If they are around the tubules, peritubular capillaries. All right. Now, let me rephrase the question. I am asking, can you name the two different types of capillaries which are found in the nephron systems? What will be the names? Vasa recta, peritubular capillaries. If I say, I want to know the names of those capillaries which are associated specifically with the cortical nephrons, what will you call? If I say, no, I want the capillaries which are there with the juxtamedullary nephron, the loop of Henle of the juxtamedullary, what will you say? Vasa recta. So first of all, make a link. When I say cortical nephrons, which capillaries will come in your mind? If I say the juxtamedullary nephrons, which capillaries? All right, all right. Okay. Let's go back and let's talk about one more thing. Glomerulus. What do you think is glomerulus, Shabab? Yeah. Tuft of what? Tuft of capillaries. All right. He's saying capillaries, all right? How many capillaries have we already talked about so far? Two. Peritubular and now we are talking about glomerulus also. So the third capillary system is also coming here, okay? Now we have to be very careful about the positions, okay? So it means there are three capillary systems present in this area, okay? Now let's arrange these systems, okay? If I am drawing it here, this is the Bowman's capsule here, okay? And all right. These are the capillaries. The blood is coming from here, okay? These are the capillaries. The capillaries which are present in the cup of the Bowman's capsule, what do you call the collection of these capillaries as? Glomerulus. Everybody is familiar, glomerulus, okay? So this is glomerulus, okay? What is this blood vessel which is bringing the blood into the glomerulus in the capillaries? Incoming afferent, okay? It's A, afferent, okay? And then the blood leaves, efferent, okay, all right. Is it an artery, vein, or what? It's an arteriole, a part of the artery, small, okay? What do you think about this one? All right. So it means you are between the two arteriolar systems. One arteriole is coming, and then it is forming a glomerulus, and then again glomerulus is forming the efferent, okay? So one arteriole, is it the normal situation in the body anywhere? No, it's the only case, special case here, okay? A very, very special case like this. So afferent arteriole, glomerulus, efferent arteriole, okay? And then from the efferent arteriole, please, now be careful. Now from the efferent arteriole, okay? If you are dividing this efferent arteriole into different capillaries, and these capillaries are covering like this the system of the cortical nephrons. If it's a cortical nephron and these capillaries, after efferent arterioles, it again breaks into the capillaries, and these capillaries are surrounding or covering the cortical nephrons, for example, then what will you call these capillaries as? Okay, so in line, now you are coming. The first capillary system that you have seen is? No, the capillary system. So use the word glomerulus, which is coming from afferent, yes, okay? But the capillary system itself is glomerulus, okay? So capillary system number one is glomerulus. What is the capillary system number two? Peritubular capillaries, okay? Now, if this is a case of the juxtamedullary nephron, for example, it's a juxtamedullary nephron, then in that case, okay, these capillaries will go down like these, okay, very long capillaries, and they will return like this. If the capillaries are like this, they are going in long loops, making few capillaries going down and turning and coming back again, okay, it will be vasa recta, okay? All right, and again now these capillaries, after coming back, they are opening into the venules, okay? So the third possible capillary system which is there is the vasa recta. So with the cortical nephron you will find two capillary systems. What are these two capillary systems? Glomerulus number one, and number two? That's it. For the juxtamedullary nephron, again you will find the two capillary systems. Number one is glomerulus and number two is vas, okay? So you got the point. Now you differentiate, okay? So according to the structure and positions you have different capillary systems. Am I clear so far? Okay. All right. So these capillary system, what do you call this? And if you go up here, okay, and what is this capillary system? What is this one? Great. Thank you. What is this picture? Renal corpuscle. Can you identify? Histological picture basically. Now you are focusing the Bowman's capsule, the layers of the Bowman's capsule, and you are focusing the glomerulus. Okay. All right. Are you comfortable with the layers here, the parietal layer and the visceral layer? All right. The parietal layer is the outer layer, you can say that. Okay. The visceral layer is the layer which is covering the capillaries, the glomerular capillaries. Okay. It has very special cells, epithelial cells, and these cells are the podocytes, you know that. And they are covering and trying to enclose or cover the capillary. If this is a capillary, the podocyte will try to cover it like this. Okay. With the foot processes like this, it will try to cover. Okay. Podocytes. All right. I also see one space here. Can you? There is a space present between the parietal layer and the visceral layer. And that space is Bowman's space. It's also called the urinary space. Okay? Bowman's space or urinary space. What do you think is present in this space here? This is the space in between. After filtration, the fluid is accumulated in this space, and then the fluid will travel and it will go into the proximal tubules. All right. Okay. Same thing. All right. Okay, please have a look. We have discussed the differences between the cortical and the juxtamedullary nephrons. I'm not repeating these differences. Size difference, the glomerulus difference, and the loop of Henle difference, all are known. Okay? Now, can you recall all these three processes which we discussed? Filtration? All right? Okay. Shabab. We are now defining the filtration. Actually, this definition is there in our mind already, and we have discussed that. In filtration, what is happening? Something is shifted from the blood into the glomerular capillaries. Okay, from the blood, from the glomerular capillaries, it is shifted into the urinary space or the Bowman space, which is there. And this process of shifting is known as the filtration. You have already told me what is filtered and what is not filtered. We know that. Okay? I think we are done with composition. It's very easy, very basic, and it's done. Okay? This picture must have seen in histology also that glomerular membrane, this is also called filtration membrane, please. Okay? This filtration membrane has three layers. These three layers are very special and they have a particular name. Layer number 1, I'm starting from the capillary side, then layer number 2, and then I'm going outside, layer number 3. Layer number 1, the first layer of your glomerular membrane, is actually the layer of the capillary, and it is the endothelial cell layer, isn't it? It's the endothelium, fenestrated endothelium, very permeable, big gaps are there so that the substances are easily filtered. So the first layer is fenestrated endothelium or the endothelial cell layer. Okay? Now, the capillary endothelium definitely supported from outside by connective tissue membrane, basement membrane. So the second layer through which the fluid has to pass is the basement membrane. But this basement membrane is filterable and the fluid can easily pass through it. Okay? It is not stopping the fluid. The third one is the final. Outside you have another cover of the podocytes. Do you remember? The visceral epithelial layers. And these visceral epithelial layers are very special. One podocyte is sending its foot processes from here, the other is sending the foot processes from here, and they interdigitate like this. When they interdigitate, you still can see some gaps in my fingers, isn't it? There are gaps. And these are the slits which are formed, and these slits will allow the third level of the filtration. So the first level of filtration is the gap between the endothelial cells. The second level of filtration is the basement membrane, the fibers of the basement membrane. The fluid has to pass through that. And finally, the podocytes are forming the slit pores, and through these slit pores, you are refining the system. System number 1, system number 2, and system number 3. After passing through system number 3, you are left with a very special fluid which is cell-free and which is protein-free, as you know. And that fluid is known as glomerular filtrate, please. Okay, the name is glomerular filtrate. Okay. So this picture is okay? All right. Another good view of the picture you can see from different angle. Okay, the first layer is shown inside with holes, the fenestrated endothelium. The second layer is the basement membrane, and the third one is the podocytes, which are coming from outside. So the fluid has to pass through 3 layers. Okay, from here, and it's passing through here and through the gaps, and it will come out. That's glomerular filtrate. Okay. If you want to filter anything, there are 2 very important points. One is molecule size, big or small. Okay, if the size is big and the holes are small in the membrane, obviously it cannot be filtered. Okay, so size is very important, first factor. Also the charge. If the charge on the molecule, please, is a positive charge or a negative charge, it counts, or it's a neutral. Okay, because these endothelial cells and the glomerular membrane fibers and the slit pores, these areas contains negative charges. Okay, remember, mainly negative charges. Now, if a substance is having a positive charge, can it pass or no? Yes. If a substance is neutral, can it pass or no? Yes. But if a substance is negative on the surface, it will have a difficulty in passing through because it will try to stop. Repulsion, isn't it? So please think about the charges. Okay, that's an important thing. Shabab, I need your attention for 10-15 minutes, please, quickly to wind up the process. Now we are starting a very important area, please. Glomerular filtration rate. Okay, please look at the definition. You know, filtration occurs all the time. Okay, but we take the filtration, if you want to study the filtration, we need some specific period of time in 1 minute. Okay, so we'll try to measure it in 1 minute, and that measurement is called the glomerular filtration rate. Okay, how much filtrate is formed in 1 minute by all nephrons of 2 kidneys. You know, all nephrons are working. You're not talking about 1 kidney or 1 nephron or few nephrons. No, you are talking collectively about all nephrons. All the nephrons of both kidneys are forming filtrate in 1 minute. How much? That is known as the GFR, or the glomerular filtration rate. When I'm writing rate, or when you're saying rate, it means time is definitely there. 1 minute, 1 second, 1 hour, 1 day, whatever. Time is definite. Okay, so we are taking it in 1 minute, please. Glomerular filtration rate, 125 ml per minute. Okay. Now please, very interesting statistics. Have a look. It's very interesting, please. Look at, we are starting our journey from the cardiac output. Okay, the heart is pumping the blood in 1 minute, and that blood is distributed to all the organs and tissues of the body. You know that. Okay, in 1 minute. Some will go to the brain, some will go to the kidney, some will go to the jilt, some will go to some other organ, to the bones, to muscles, like this. This distribution. In this way, the kidneys are also receiving, the 2 kidneys are also receiving a specific amount of the blood. How much is the cardiac output? You know that. It's about 5.5 liters usually. Out of that 5 liters, how much blood is diverted to the kidneys, 2 kidneys? About a liter, 1100 ml, 1 liter, something like that, isn't it? Okay. 1/5 of the blood is coming all the time to the kidney at resting conditions. Now, the blood which is coming to the kidneys in 1 minute is called renal blood flow. What do you call it? Renal blood flow is coming to both kidneys. Okay? How much is written here? 1100? Out of 1100, what do you think? This is distributed to the two kidneys.